Megalomania is a psychopathological condition characterized by delusional fantasies of power, relevance, omnipotence, and by inflated self-esteem. Adolf Hitler is widely considered to have been a megalomaniac. Historically, it was used as an old name for narcissistic personality disorder prior to the latter's first use by Heinz Kohut in 1968, and is used today as a non-clinical equivalent. It is not mentioned in the Diagnostic and Statistical Manual of Mental Disorders or the International Statistical Classification of Diseases. Etymology: the word megalomania is derived from the Greek I1/4 I micron I cubed I plus or minus II, megalo large, great, and I1/4 I plus or minus I1/2 II plus or minus mania madness, frenzy. The first attested use of the word megalomania in English is in 1890 as a translation of the French word mar copyright galomanie. Early Freudianism: Sigmund Freud commented of the adult neurotic's sense of omnipotence that a Euro-oethis belief is a frank acknowledgement of a relic of the old megalomania of infancy Euro. He similarly concluded that you can detect an element of megalomania in most other forms of paranoid disorder. We are justified in assuming that this megalomania is essentially of an infantile nature and that, as development proceeds, it is sacrificed to social considerations Edmund Bargler also considered megalomania to be normal in the child, and to be reactivated in later life in gambling. Otto von Eichel states that, for those who react in later life to narcissistic hurt with denial, a similar regression to the megalomania of childhood is taking place. Object relations: whereas Freud saw megalomania as an obstacle to psychoanalysis, in the second half of the 20th century object relations theory, both in the States and among British clinicians, set about revaluing megalomania as a defense mechanism that offered potential access for therapy. Such an approach built on Heinz Kohut's view of narcissistic megalomania as an aspect of normal development, by contrast with Kohnberg's consideration of such grandiosity as a pathological development distortion. Every day, as well as a symptom of pathology, a degree of megalomania is a way of defending against loss in everyday life, a manic defense against the experience of separation and loss. When linked to a position of power, whether military, political, or control-freak bureaucratical, it is likely to lead to miscalculation as a byproduct of the figure's swollen head. Therapy: because the megalomaniac tends not to be particularly interested in examining or in changing the self, talking cures may be less effective than medication in their treatment. The transference in a talking cure may also be compromised by the patient's enhancement of any megalomaniac tendencies within the analyst him herself. See also. References. Further reading: Lewis, Michael J. Ego, Vanity and Megalomania. An article from New Criterion, Robbins, John. Ecclesiastical Megalomania, The Economic and Political Thought of the Roman Catholic Church ISBN 0-940931-78-8, 1, Roberts, John. Megalomania, Managers and Mergers, Rose, Larkin. How to be a Successful Tyrann to the Megalomaniac Manifesto, Rosenfeld, Israel. Freud's Megalomania, a Novel, Skull, Andrew Madhouse, A Tragic Tale of Megalomania and Modern Medicine, Slay A. Hitler, A Study in Megalomania. Canadian Psychiatric Association Journal 1966. John. 11, 3, 218-9. Tretiak, Philippe. Megalomania, Too Much is Never Enough. External links: Arcane, What is Megalomania?